Viral myocarditis is the inflammation of the muscles in the walls of the heart due to infection. In 1999, Andrea Carrol, then 27, was diagnosed with the illness. As a survivor, Carrol now works with the American Heart Association to bring public awareness to the potentially fatal condition.
And I had flu symptoms, did not know what was wrong, just thought I had the flu. But after going to an emergency room, going to my primary care physician, I was finally diagnosed with viral myocarditis, which the viral portion was a flu, which could be a flu or bacteria, and that attacked my heart muscle. And it makes your heart muscle weak, and it's not able to function like you and I are today. So I was extremely tired, which is a symptom of having the flu. And I could not determine the difference between the two.
Prior to that specific day, did you have any kind of indications that something was wrong with your heart? Did you have any pain, any shortness of breath, anything?
No. I was 27 years old. I worked out twice a week, sometimes 3. I could, go out after work, and, everything was fine. I was very healthy and had no other conditions associated with heart or anything else. So,
do you have any idea how you got this virus?
That's the scariest part, and that's one of the reasons why I do speak out, especially to women, for people to recognize and know what's going on with your body. So you know how you feel on a particular day. If there are any instances where you feel abnormal, even if it's slight, women especially should monitor that. A lot of times heart disease is masked and it does not have a particular face to it. So some people think if you're overweight, if you have diabetes, those are the reasons why you will have heart disease, and it's not true. Unfortunately, it's not true.
There are many more reasons.
Many more reasons. Genetics. Some people, could be a size 6. They could run every day, but if their mother died of a heart attack and their grandmother died of a heart attack, those are the people that need to pay considerable amount of attention and make certain that that information is brought up to their physicians.
It's been 12 years now. What is your day-to-day life like?
Oh, it's normal. Okay. It's normal, but what I do, I make certain that I do visit the cardiologist once a year. I'm able to get tested with the cardiologist, and he just runs the gamut just to make sure that everything is okay. And that's a precautionary thing that they do recommend that I do for American Heart Association, and specifically the Go Red for Women campaign. We encourage that women and everybody watch their numbers as it relates to your blood pressure, your cholesterol. So I'm cognizant of those. For me, fortunately, they are not high, which is a good thing. So I definitely, keep pushing and making sure that those numbers stay at controllable levels.
What message would you like to convey?
I think just to women in general, to speak up for yourself. Speaking up for yourself could save your life. It could save someone else's. If you are experiencing something different to your body, if you feel sick and it's an awkward thing, speak up for yourself. A lot of times people, and these people love us, but they'll say, oh, it's nothing wrong with you. But you tell them it is something wrong with you and that you do need to seek medical assistance. So I would just encourage, all of your viewers to log on to goredforwomen.org, and they can find tons of resources if they need some further information on what I'm saying, would like to live a healthier life, they can start there.
And that was Andrea Carrol, a heart disease survivor. Vincent?
Well, thank you very much for that excellent segment on heart disease. Be sure to watch for Linord Moudou's health reports every Tuesday and Thursday right here on In Focus.